So our Mrs. Homeostasis part 3, and this will be the last part about homeostasis discussion. So in previous discussion we have stopped here, and next we'll start from here: normal ranges and physical characteristics of important cellular fluid constituents. Normal ranges of different constituents in the cellular fluid. So you will have to know about ECF and ICF and their composition and their differences. So in the Chiton, this chapter we have found, we will only discuss about the extracellular fluid, that is most important sodium ion. Concentration is 135 to 145. Potassium ion 3.5 to 5.3. This is millimole per liter. Millimole per liter. Calcium, normal range 1 to 1.4. Chloride ion 98 to 108 millimole per liter. Millimole per liter. Remember, millimole per liter, but oxygen, carbon dioxide 25 to 40 in case of oxygen, that is millimeter of mercury. Carbon dioxide 41 to 51 millimeter mercury. Bicarbonate 20 to 29. 22 to 29 millimole per liter. Glucose 70 to 115 milligram per deciliter. So you'll have to memorize sodium ion, potassium ion, calcium ion, chloride ion, bicarbonate ion, glucose. Normal body temperature, you will have to must remember 98 to 98.8, that is 37 degrees centigrade, and this is Fahrenheit. 98 to 98.8 Fahrenheit, and this is 37 degrees centigrade. Most important are the limits beyond which abnormalities can cause death. Most important are the limits beyond which, that is, if you see this potassium ion, that is 3.5 to 5.3, that may more than 5.3, it will be harmful for the body. Less than 3.5, it will be harmful for the body. Temperature is decreased, it is hypothermia, it may cause death. For example, an increase in body temperature of only 11 degrees Fahrenheit, that is only 7 degrees centigrade, above normal, can lead to vicious cycle of increasing cellular metabolism that destroys the cells. Vicious cycle. Note also the narrow range for acid balance in the body with a normal pH value 7.4. Normal pH value 7.4. This is an average, and in range 7.3 to 7.5, and the lethal values of only 0.5 on either side of the normal. Whenever the potassium ion concentration decreases to less than one-third normal, one-third potassium level 3.5 to 5.3. If it decreases one-third of normal, that is 4.2, 1 point less that is 1.5, one-third, 4.5, it's one-third, 1.5. Paralysis may result from the inability of the nerve to carry signals. Its potassium level concentration decreases to less than one-third normal, paralysis may result. Alternatively, if the potassium ion concentration increases to more or 2 or more times normal, the heart muscle is likely to be severely depressed. On the other hand, potassium ion, if increased 2 times normal or more, now more than 9 or 9, it will causes heart muscle severely depressed. Also, when the calcium ion concentration falls below about one half normal, the person is likely to experience tetanic contraction, that is called tetany. Calcium ion concentration average 1.2. If it is less than 0.5, 0.6, tetany will be happened because of the spontaneous generation of excess nerve impulses in the peripheral nerves. When glucose concentration falls below one half normal, a person frequently exhibit extreme mental irritability. This means glucose is decreased, mental irritability will be happened. Sometimes there may be convulsion. This example should give one an appreciation for the necessary of the vast number of control systems that keep the body operating in health. In the absence of any of these controls, serious body malfunction or death can result. So next we'll discuss about characteristics of the control systems. The aforementioned examples of homeostatic control mechanisms are only a few of many thousands in the body, all of which have some common characteristics as explained in this section. Negative feedback nature of most control systems. So control system, how the homeostasis is controlled. There are two control systems, negative feedback, positive feedback control system. Negative feedback nature of most control system. Body is controlled mainly by the negative feedback control system. Most of the control systems of the body act by negative feedback. You will must remember it and you will be asked in the Viva exam, which system is more? You will answer negative feedback system, which can be explained by reviewing some of the homeostatic control system mentioned previously. In the regulation of carbon dioxide, if this carbon dioxide concentration or cell concentration we have already discussed, that is when carbon dioxide concentration is increased, it is regulated by the negative control system to the baseline, and when it is decreased, it will be increased. So, if you ask to describe negative control system, you may describe carbon dioxide concentration maintenance system or blood pressure control system. If you read this in the regulation of carbon dioxide concentration, a high concentration of carbon dioxide in the extracellular fluid increases pulmonary ventilation. This in turn decreases the extracellular fluid carbon dioxide concentration because the lungs expel greater amounts of carbon dioxide from the body. Thus, the high concentration of carbon dioxide initiates events that decrease the concentration to a normal, which is negative to initiating stimulus. Conversely, carbon dioxide concentration that falls too low result in a feedback to increase the concentration. This response is also negative to the initiating stimulus. Whereas when it is increased, it is decreased. When it is decreased, it is increased. In the arterial pressure regulating mechanisms, a high pressure causes a series of reactions that promote reduced pressure, or a low pressure causes a series of reactions that promote increased pressure. In In both cases, these effects are negative with respect to the initiating stimulus. Therefore, in general, if some factor becomes excessive or deficient, a control system that initiates negative feedback, which consists of a series of changes that return the factor toward a certain mean value, thus maintaining homeostasis. This is the definition of negative feedback system. And these are the example of negative feedback system. One, extracellular fluid carbon dioxide concentration maintenance and arterial pressure maintenance. So what you say? What is negative feedback? If some factor becomes excessive or deficient, a control system initiates negative feedback, which consists of a series of changes that return the factor toward a certain mean value, thus maintaining homeostasis. This is the definition of negative feedback system. Next, very important topic for you in the Viva question. What is gain? What is gain? Gain of a control system. The degree of effectiveness with which a control system maintains constant condition is determined by gain of negative feedback. So, what you will say? The degree of effectiveness with which a control system maintains constant condition is termed as gain of the negative feedback. For example, read it very minutely. For example, let us assume that a large volume of blood is transferred into a person whose baroreceptor pressure control system is not functioning. What is baroreceptor? The baroreceptor is the receptor that are the sensoreceptor that sense the blood pressure has increased or decreased. They are present at the bifurcation of the aorta and the arch of the aorta. Bifurcation of the carotid artery and arch of the aorta. So if the baroreceptor control system, say, control system is not functioning, and another point, a large volume of blood is transferred into a person whose baroreceptor is not functioning. Again, see, a large volume of blood transferred into a person whose baroreceptor is not functioning, and the arterial pressure rises from 100 to 175 millimeter mercury. That is increased only 75. Then let us assume that the same volume of blood is injected into the same person and the baroreceptor is functioning. Two person, one person has baroreceptor that is not functioning, another person who has baroreceptor functioning. Same blood pressure in 100 millimeter mercury, who before injecting blood. So in the person who have baroreceptors functioning, his blood pressure increases only 25 millimeter mercury, that is 125. Thus, the feedback control system has caused a correction of minus 50 millimeter mercury. Again, we read it. Let us assume that a large volume of blood is transferred into a person whose baroreceptor pressure control system is not functioning and the arterial pressure rises from normal 100 to 175 millimeter mercury. Then let us assume that the same volume of blood is injected into the same person when the baroreceptor is functioning, and this time the pressure increases only 25 millimeter mercury. The difference is minus 50 millimeter mercury. So the feedback control system has caused a correction minus 50 millimeter mercury from 175 to 125 millimeter mercury. There remains an increase in pressure plus 25 millimeter mercury. After correction, only 25 millimeter mercury blood pressure has increased in the person who have baroreceptor is functioning. This 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 increased 25 millimeter mercury is called error, which means that the control system is not 100% effective in preventing the change. The gain of the system is then calculated by using the formula gain is equal to correction by error. Correction 50, error 25. Correction minus 25, correction minus 50, error plus 25. So what is the gain? Minus 2. Minus 2. That is the disturbance. That is the disturbance that increases or decreases the arterial pressure does so only 1/3 as much as would occur if this control system were not present. You will read it, you will remember it, this control system and this example you must memorize and one will have to remember, because when gain is asked and how it works and how it's calculated, you will have to describe it in written and viva. So homeostasis controlling system is controlled by two systems, one negative and another is positive feedback system. So now we'll discuss about positive feedback system. Positive feedback because vicious cycle and death. Most of the Why does most control system the body operate by negative feedback rather than positive feedback? If one considers the nature of positive feedback, it obvious that positive feedback leads to instability rather than stability, and in some cases can cause death. Now we'll discuss how positive feedback system may cause vicious cycle and death. This is a figure. We will discuss it. Figure 1 shows an example in which death can ensue from positive feedback. This figure depicts the pumping effectiveness of the heart, showing the heart of a healthy human pumping 5 liters of blood per minute. We know that heart pump blood per minute 5 liters per minute. If person suddenly bleeds a total 2 liter, the amount of blood in the body is decreased to such a low level that not enough blood is available for the heart to pump effectively. So, when we discuss it, the figure shows the pumping effectiveness of the heart, liters per minute, 5 liter. Assume 2 liters blood bleeds away. from the body. If a person suddenly bleeds a 2 liters, the amount of blood in the body is decreased to such a low level that not enough blood is available for the heart to pump effectively. If bleeds 2 liters, enough blood is not present to pump by the heart. As a result, the arterial pressure falls and the flow of blood to the heart muscle through the coronary vessels diminishes. This scenario results in weakening of the heart, further diminished pumping, a further decreased in coronary blood flow, and still more weakness of the heart. The cycle repeats itself again and again until death occurs. Note that each cycle in the feedback results in further weakening of the heart. That is, the heart has weakened, it is further weakened. In other words, the initiating stimulus causes more the same, which is positive feedback. Positive feedback is sometimes known as vicious cycle, but a mild degree of positive feedback can overcome by the negative feedback control system, and the vicious cycle then fails to take place. For example, if this 2 liter blood is not bleeded, that if occurs 1 liter, then the heart would pump normally, and by the negative control system, the cardiac output and arterial pressure can be counterbalanced, the positive feedback system, and the person can recover. So you will be asked 2 questions from here. One, positive feedback system may cause vicious cycle. How? You will describe and you will memorize it because this is a written question. And another is that if you may ask, if bleeds 1 liter, what would be happen? You will say positive feedback system will be replaced by negative feedback system and the patient will recover. So what is positive feedback system? The system or the it is the system in which the initiating stimulus causes more of the same, more of the same. That is, if the pain increase, if you feel pain, the pain will be increased. If it bleeds, the bleeding will be increased. If clot is formed, the clot will be formed more. If the nerve signal is generated, the nerve signal will be more. Positive feedback can sometimes be useful. How? The body sometimes uses positive feedback to its advantage. Blood clotting is an example of a valuable use of positive feedback. That is, think you have injured and the injured side is opened and bleeding. Sometimes you will compress it, and after some time you will found that there is a clot and blood has stopped. In this situation, positive feedback will help you to stop bleeding. When a vessel is ruptured and a clot begins to form, multiple enzymes called clotting factors are activated within clot. Some of these enzymes act on the inactivated enzymes of the immediately adjacent blood, thus causing more blood clotting. This process continues until the hole in the vessel is plugged and bleeding no longer occurs. So one example is blood clotting. On occasion, this mechanism can get out of hand and cause formation of unwanted clots. Sometimes this may be harmful and causes heart attack, venous thrombosis, and others. In fact, this is what initiates most acute heart attack, which can be caused by a clot beginning on the inside surface of the atherosclerotic plaque in a coronary artery and then growing until the artery is blocked. So, positive feedback is useful to stop bleeding by formation of clot, but excess clot or uncontrolled clot formation may sometimes be harmful and may cause heart attack. Childbirth is another situation in which positive feedback is valuable. When uterine contraction becomes strong enough for baby's head to begin pushing through the cervix, stretching of the cervix sends signals through the uterine muscle back to the body of the uterus, causing even more powerful contractions. Thus, uterine contraction stretches cervix and cervical stretch causes stronger contraction. So, in a nutshell, if we describe when during childbirth, the uterine contraction begins. So, more contraction will be occur the uh, to deliver the baby. So, this is useful example of positive feedback system. Another important use of positive feedback for the generation of nerve signals. So, what are the examples of positive feedback? Blood clotting, childbirth, and nerve signals. Stimulation of the membrane of nerve fiber causes slight leakage of sodium ions through the sodium channel in the nerve membrane to the fiber's interior. So, in the next discussion, we'll discuss how action potential is generated. So, if I uh, make you understand mm, in a short that how sodium helps to generate impulse. Sodium ion, when sodium ion enters into the membrane, it will causes depletion and at first slight sodium enters and when slight sodium enters the more sodium will enter and this will increase up to the level to up to the threshold level to form the action potential or a nerve signal. The sodium ions entering the fiber then change the membrane potential. So sodium ion entering is called depolation and it causes action potential or membrane potential, which in turn causes more opening of channels and more change of potential is still more opening of the channel and so forth. Thus, a slight leak becomes an explosion of sodium entering the interior of the nerve fiber, which creates the nerve action potential. So there are three examples in positive feedback system and how the nerve signal is generated, it will be discussed in the next action potential or membrane potential chapter. So just at the ABC knowledge, you as because you have started the first chapter, you may be confused how sodium causes nerve signal. Just remember it that sodium ion is needed to enter into the membrane that is called depolation to generate action potential. And at first, few sodium ion channel opened and it is increased up to the threshold level to generate action potential. In each case, in which positive feedback is useful, the positive feedback is part of overall negative feedback process. For example, In the case of blood clotting, the positive feedback controlling process is a negative feedback process for the maintenance of normal blood volume. You should not read it, or you should not keep it in mind. Just remember what is negative positive feedback mechanism. Positive feedback may cause vicious cycle and death. How and what are the examples of positive feedback system, and what is positive feedback system? Another most important topic is more complex types of control system: feed forward and adaptive control. Later in this text, when we study the nervous system, we shall see that this system contains great numbers of interconnected control mechanisms. Some are simple feedback systems similar to those already discussed. Many are not. For example, some movement of the body occurs so rapidly that there is not enough time for nerve signals to travel from the peripheral parts of the body all the way to the brain and then back to the periphery again to control the movement. Therefore, the brain uses a mechanism called feed-forward control to cause required muscle contraction. That is, there are some movement of the body occurs so rapidly, like dancing. During dancing, the hands and foot, hands and legs are so rapidly moved that uh, the normal system not coincide with the rapidity. In this situation, in this situation, feedward control system is activated. Therefore, the brain uses a mechanism called feedward control to cause required muscle contraction. How? Sensory signals from the moving parts apprise the brain about whether the movement is performed correctly. If not, the brain corrects the feed-forward signals that it sends to the muscle the next time the movement is required. Then, if still further correction is necessary, this possible will be performed again. This process will be performed again for subsequent movement. This process is called adaptive control. Adaptive control is a sense is delayed negative feedback. So, feed forward control to cause required muscle contraction. On the other hand, adaptive control. If not, the brain corrects the feed-forward signals that it sends to the muscles the next time the movement is required. Then, if still further correction is necessary, this process will be performed again for subsequent movement. That is called adaptive control. Adaptive control, in a sense, is delayed negative control. This is negative. This is delayed. So, if you remember it, feed-forward control, that is good for you to get more marks. But if you fail to say, then it will not make you upset. So this topic is not very important for you uh, from this. So in a nutshell, if we discuss what is homeostasis, homeostasis is the maintenance of nearly constant condition of the internal environment. How homeostasis is controlled by positive feedback system and negative feedback system. What is positive feedback system and what is negative feedback system? So, what is negative feedback system? If some factors become excessive or deficient, a control system initiates negative feedback that will consist of a series of changes that return the factor toward a norm, toward a certain mean value, thus maintaining homeostasis. That is, if blood pressure is increased, the negative feedback system will be initiated and try to will try to bring the blood pressure to the normal range. On the other hand, if it is in decreased, the negative feedback system will try to bring the blood pressure to the normal range. What is positive feedback system? If uh, if the initiating stimulus causes more of the same, it's called positive feedback system. That is, if blood clot if during bleeding, blood clot formation is a positive feedback system. During childbirth, uterine contraction increases more and more and causes childbirth. When nerve signal generated, more and more sodium will enter into the membrane and will cause nerve signal. And how the positive feedback system and negative feedback system is maintained. They are maintained by different control systems like nervous system and hormone system. This hormone and nervous system maintain the other systems of the body, and you will have to read through this chapter to understand more and more. I think it will be beneficial from this discussion. Okay, thank you. Thank you very much.